Terrific. Thank you so much, and thank you. This is a beautiful venue, and it's exciting to be here on the inaugural seminar, and thank you for organizing this. So as Marie shared, there's a little bit of a gap in my knowledge, so in terms of when I was a little bit more peripheral, so I will certainly refer to others here as well to fill in any questions that I can't answer. But just wanted to take just about 5 minutes to share a little bit of background about Alive and Thrive, really the design, as Purnima will be sharing much more on the results. So Alive and Thrive, as has been shared a bit, is an initiative started in 2009, as Marie shared, as Ellen's brainchild, that we'll be discussing its different iterations and where it is now. But it really is an initiative to save lives, prevent illness, and ensure healthy growth and development. And we do that through maternal nutrition, breastfeeding, and complementary feeding. The original focus of Alive and Thrive was very much and is on the 1,000 days, and the first iteration actually was much more focused on breastfeeding and complementary feeding in particular. The maternal piece has come on a little bit later, and we'll talk more about that as well. We're an initiative that is primarily funded by the Gates Foundation, as you now know. We also do receive funding from Irish Aid and Global Affairs Canada. Hopefully you can see this, but we'll be talking more about kind of the different lives of Alive and Thrive. But the first part of Alive and Thrive, which I'll mention in a moment, 2009 to 2014, what we call phase 1, and we confuse ourselves with our phases and all of that, so don't worry too much about that, but in the darker blue. And that's important because we did start in 3 primary countries, and then we spanned out in phase 2, which is kind of the time frame we're in now, in fact, to the lighter blue, and we've had regional approaches, and we have now included some more work in the green, and we are soon to embark on even more work that I'll be describing a bit later. But this just gives you a little bit of a sense of kind of the timing and expansion. Alive and Thrive was always, as mentioned, a learning initiative, and the real focus of the early work was at scale. In the end, what we were able to do during this phase 1 was reach about 16 million mothers of infants with children less than 2 years of age. And that was really reflective of the objective of phase 1, which was proof of concept, and proof of concept that you can change infant and young child feeding practices at scale in 3 very different contexts. So we did want to look into contexts that were more food insecure, ones that were more food secure, ones that had transitional economies, and the different issues and platforms that you would use obviously would be very, very different. I think that learning has served us very well, and Purnima will be sharing that. We then went into phase 2, which is what we're in now. And what we did from that is really take a lot of those learnings, and I'll be sharing a framework in just a moment that was derived from the phase 1 experience and the work that we did, and applied that framework in different settings and looked at the processes and the tools and saw how those worked in the different settings that we are working in, and also with new platforms, including things like working with the ag sector, reflective of kind of more of the science that we know now about multi-sectoral work and the linkages that we need to make, really building out the maternal piece that we didn't have early on. So it really, again, has really kind of grown and morphed over time to reflect both the science and our learnings. So we're formally kind of in this phase 2 period of time right now. And one of the things that I think is really interesting is that during phase 1, again, it was really about impact at scale. One of the assessments that we're doing that we won't be sharing the results on because they're not in yet, but looking at the sustainability of those impacts from phase 1 in 2 of the original countries. So going back to Vietnam and going back to Bangladesh and seeing kind of what lives on, where platforms changed, where systems changed, behaviors changed, where those sustained changes. So that's yet to come. But through, again, each of these iterations, we've had very explicit kind of learning objectives. I just want to share this for a moment as an example of one of the key things that really did emanate from the phase 1 work that Purnima will be sharing. And I'll talk more about this in the remarks, but our very powerful, I think, partnership, the collective kind of efforts of the consortium that included so much great work from IFPRI was also the ability to really disentangle some of the pieces that created the change that we saw. And we were eventually able to articulate those. And I think what is a fairly kind of of deconstructed and simplified down framework as a framework should be, sharing what we think the key components are based on the evidence. And again, Purnima will be sharing this evidence. But this is essentially what we then applied during the phase 2 that I mentioned in terms of using our processes and tools and seeing how things worked after the original 3 countries. So this emanated from our work and our research, which you'll hear about in a moment. And just to finish off the kind of 5-minute, 10 years in a nutshell introduction, we are now into what we're now calling Gen 2. So we're done with our phases and we're on to Generation 2. And that happily was just awarded from the Gates Foundation. And this will be looking at new geographies, including West Africa, which is new for us, other than Burkina Faso. And you can see our vision for Gen 2. We are working now in earnest to figure out what this actually means and what this will look like. Happily, we are working with all the same partners that we've always worked with, and it's really exciting. So we're really in infancy in conceptualizing some of this and working towards what this will look like in countries, regions, and globally. But just wanted to give a little bit of a frame before Purnima took the podium. So thank you.